And then GenAI solutions. A lot of people are talking about GenAI solutions. And here is one such solution that we built for a starter. Dr. Ilan Kumaran, who is the CEO of Apollo Chennai region. This is his startup. And he was saying that doctors spend a lot of time writing the discharge summary for the patients or creating a post-discharge instructions, or whenever a patient is moved from one specialty to another, then there has to be some a document which has to be sent alongside that. Either nurses or healthcare administrators or doctors involved in creating such reports. And a lot of time is spent on that. Can be automated. A. B. There is a lot of attrition, nurses, etc. There's a lot of attrition at that level, is what I was told. And whenever we train nurses on the hospital processes, and if there is attrition, new person will come again, you'll have to train that person. No matter how much training we give, we are humans at the end of the day. We might not remember all the procedures and protocols in the company, and there might be slippages. Can we arrest that using generative AI? Absolutely, we can. And that is what we did. We have taken a large language model, which is trained on medical literature, not ChatGPT stuff, because that is trained on internet data, Wikipedia, Reddit, Common Crawl, etc. How can that be relevant to medical literature to a great extent? No. So we have to pick large language models which are trained on medical literature, A. B. We have to take the hospital processes, procedures, protocols, etc. And when we build a system which is called as RAG system, this hospital data is integrated with this large language model. And eventually when questions are asked that I'm moving the patient from one specialty to another, what protocols or what procedures do I need to follow? If the nurses ask using a voice message, they should be able to see the steps which have to be followed, right? This will ensure that the slippages which are caused because of human errors are avoided. And a lot of efficiency can be brought in because reports can be generated faster. And we also built an agent in this. What this agent does is, it will go and look at the hospital management system and pull all the relevant information pertaining to this patient and automatically create a report. So the doctor, even before attends this patient, doctor will have the entire report pertaining to this person. All right. So in this way, a lot of solutions can be built. Oops, this is not the one I was referring to. Only for embryo, I wanted to refer to this particular use case. And in that way, there are a lot of solutions which are possible. We also built a solution for a dermatologist from ISB, Indian School of Business, where she was saying that we want a solution where the moment you take a photo, using the texture and color, etc., it has to automatically recommend two things. A, the kind of procedure which has to be done. B, what kind of cosmetics should be used by this person. We build this solution, it is live and people are using this. Okay, so a lot of other life sciences, healthcare, generative AI models we have built. A few of those have already showcased. All right, hope this gives a gist of what are the possibilities of AI and generative AI solutions in the space of healthcare and pharma. And a few of the research papers, etc., we published and awards and accolades are given. Yeah. Thank you so much for your patience, and hopefully it gave you a few new dimensions to think through.